Hey everyone, welcome to another edition of EdTalks. I'm with my good friend, Dr. Alan Weiss. Alan, welcome to EdTalks.
Nice to be here.
Alan, you and I have known each other for quite some time. We have a little overlap in our careers, but for those who don't know who you are, share a little something about your background.
Yeah, my background is a little bit different than a lot of physicians. I actually have a computer science degree. It's actually computer science and philosophy. And after undergrad, I worked in the pharmaceutical industry, not as a salesperson, but as a data analyst. I used to help create the databases and analyze them for the FDA and for medical journals. I spent a couple of years helping to support Prozac at Eli Lilly, trying to keep it on the market and deal with some of the allegations that were going on against it. It was really interesting, really fun. I didn't know how I could transition to medicine though. I got interested in it. So I started an MBA and I have a double major in my MBA in healthcare management and the management of computer systems. And then I went to medical school. After residency in internal medicine, I joined the Cleveland Clinic. I'm from Cleveland, Ohio. And, it was fun to go back there. I worked on their main campus in a role that was, well, multifaceted. I was a practicing physician on the outpatient side. I did about 9 months of outpatient care, about 3 months of inpatient care. And in the process of doing all that, I did a bunch of informatics projects. When I joined the Cleveland Clinic, they had just implemented Epic, that's their electronic medical record. I helped them with the implementation, and then I helped with the optimization. I had a bunch of different projects in which I was using the EHR to either improve how efficient physicians were and nurses were, or using the data of the EMR to in some way improve outcomes, either clinical, operational, or financial. It was really interesting. That kicked off a whole career for me of informatics. I spent a few years at Cedars-Sinai helping implement Epic on the inpatient side. Then I went to Memorial Hermann to implement Cerner on the ambulatory side. For about 7 years, I was at the BayCare Health System in Tampa, Florida, as their system CMIO. And in that role, I had all informatics reporting to me. It was a Cerner shop. We did a lot of optimization work. And my last role was at the Banner Health System, in which I was the SVP of Clinical Advancement. That role is sort of like a Chief Health Information Officer role. It has all of informatics reporting up to it, the simulation labs reporting up to it, telemedicine reported to it. So it's sort of like a CHIO role on steroids.
Yeah, that's pretty cool. And you and I connected not too long ago as executive in residence at the Health Management Academy, and you were sharing sort of a major decision that you needed to make on behalf of your family and self. Tell us a little bit about that.
Yeah, for the roughly 15 months that I worked at Banner, I commuted between Tampa and Phoenix. And I'd go there, well, some weeks it was every week, some weeks it was every other week. I did 40 round trips in 15 months. And that took a toll on my family. It took a toll on me physically. It was hard for everybody. And recognizing how difficult it was on everybody, I realized I had to step away. It's the right thing to do for the family. It was the right thing to do for my health. So I stepped away a few weeks ago and I'm busy trying to find my next position.
Yeah, and like I was alluding to, that's a tough decision. I've been there before as well. Many people will just plow on at great detriment and consequence. Tell us a little bit more about like going through that, because that's a tough decision that I imagine a lot of people listening think about. And it doesn't even have to be a commuter issue, right? It could be just a high stress
Sure.
environment that they might find themselves in.
Well, certainly there was plenty of stress, but every position I've been in has their work stress.
Yeah.
These are leadership positions at large organizations, and no matter what, there's going to be stress involved. The banner position, because of the commute, was particularly difficult on a personal level. It was very difficult on my wife and daughter. It was hard for me to leave. All I thought about when I left was how much I wanted to be home.
Yeah.
I felt guilty the entire time. I also lived in two time zones, 3 hours apart, and so that was particularly difficult overall. When I was back in Tampa for weeks, I would end up on meetings until 9 or 10 o'clock Phoenix time. I was still trying to get up early to wake my daughter up for school and still trying to exercise. I burned the candle at both ends for about 15 months. And I realized that I was doing something that was detrimental to my family and detrimental to my own health. So I really had to think about it and made the choice of stepping down. One of the inspirations was actually something I read in JAMA. There was an article written by a woman called "Life is Finite," and unfortunately, she has developed cancer, lung cancer, and she's had to reevaluate her life and rethink her priorities.
Yeah.
As a physician, I have dug myself into every position I've thrown myself in wholeheartedly with as much energy as I can, a lot of times to the detriment of my own personal life. And it's time for me to rethink that. And
Yeah.
that was a tough choice, especially not having a position, but the right one for us.
Yeah, no, that's very bold and courageous and the right thing. And like I said, a lot of us don't do it. And we had that physician on as a guest on the podcast, which we'll put your previous podcast that we did together and hers in the show notes. And people definitely need to go
Mhm.
listen to both. So that so again, congratulations. A difficult decision, but the right one. So what are you looking for now? So some people are watching. You're a great leader, a great clinician, a great people person, a great family person. I think a lot of organizations will be really interested in what would be one of the ideal type circumstances.
You know, I'm still trying to figure that out, and I wish I could say that at this age I figured out what I want to be when I grow up. But as my wife and daughter will tell you, I don't really want to grow up. The thing is, I do love informatics. I love the tech world. That's really exciting. I never thought I'd drift this far away from patient care. I always thought that I'd have more practice in there. So part of me is thinking about returning to just straight patient care. But then also, I mean, I still like the informatics. I'd still like to be able to have that kind of blended role that I've had in the past. So I'm trying to consider which one I want to do. And since I stepped down, I've had a number of startups that have actually asked for my help. I've had some health systems that want me to do some consultation for them. I know I'm going to find something. There's stress for me to try and figure out what that is, in part because I'm such a type A personality. It's hard for me to not have something,
Yeah.
but it's actually good for me to learn how to breathe again and relax. So I'm going to try and take this one day at a time and stay open to the opportunities and make a decision later on this summer.
Yeah, on that is I think that's a super way of handling it. Take advantage of this moment in time because it won't be like this for long. But yeah, I'm sure there's health system executives listening now to you. It's like you'd be a great addition to their team. Absolutely. So we'll
No,
put
thank you.
all of your connection, LinkedIn, all that kind of stuff in the show notes. Al, thank you for being so vulnerable and sharing what's going on in your life, and great to have you on Ed Talks.